right, good afternoon, everyone. It's gotten to be 1 o'clock, and I want to welcome everyone to the Rutherford County Benefits and Insurance Committee meeting. So we'll ask Ms. Thompson to do our roll call, please.
Dr. Andrea Anthony. Yes. Commissioner Carl Boyd.
Here.
Amber Brown. Here. Shay Crowell. Holly Deering. Here. Brian Gaither. Here. Lois Miller. Here. Commissioner Alan McAdoo. Commissioner Jeff Phillips. Brian Runyon. Here. Shantae Sherrill. Here. Steve Spence. Here. Eric Tutobeni.
Here.
Okay. All right. Okay. Our first item on the agenda this afternoon is going to be approve the minutes from our last meeting. Do I have a motion, please? A motion from Ms. Lois. Do I have a second? Polly? All right. Any discussion? All right. Hearing none, we'll call all those for aye. Any opposed? All right. Motion passes. The next one, we'll call on Mr. Ed Elam, the Risk Management Director, for our financials.
Thank you, Chairman Hickerson. So for the month of September 2022, you'll see the revenue on the calendar year, $9,221,926. Expenditures, $6,423,597. The difference is a positive $2,798,329. The total for the calendar year, $63,163,964 in revenue. For expenditures, $60,237,927. Revenue less expenditures, a positive $2,926,037. And for the fiscal year, the total is $212,085 in revenue, and in expenditures you have $20,089,314. Bless you. And for revenue less expenditures, we have a negative $6,877,229. That's the 264 fund report. 266 fund report. Fiscal year for the month of September, workers' comp, you have $1,097.26. OJI, you have $56,969.88. The total for the month of September, $58,067.14. For the year to date, you have $1,354,013.01 in workers' comp. OJI, $134,543.05. And the total for the year to date, $1,488,556.06. And that concludes my report, Mr. Chairman Hickerson.
All right. Do we have any discussion? I guess we'll go ahead and get a motion on the floor before we can do discussion. Do I have a motion to approve the financials as presented? Steve, thank you. Do I have a second? All right. Thank you, Ms. Lois. All right. We've got a motion. Is there any discussion on the financials as presented? Hearing none, Ms. Thompson, if you'll go ahead and do us a roll call vote.
Dr. Andrea Anthony. Yes. Commissioner Carl Boyd. Yes. Amber Brown. Yes. Holly Deering. Yes. Brian Gaither. Yes. Lois Miller. Yes. Brian Runyon. Yes. Shantae Sherrill. Yes. Steve Spence. Yes. Eric Tutobeni. Yes.
Right. Thank you. The next item we have is we'll call on Ms. Susan Thompson for our OSHA report.
The OSHA report for September 2022, we had a total of 12 incidences. That brings our calendar year-to-date total to 131. Of that 131, there was 100 that were OSHA recordable, with 51 restricted days, 21 lost days, and 28 other recordables. On the next page, you'll see that comparison for this year's total of 131 to last year at 130 and 2020 at 119 for this same time year-to-date. The incurred dollars for 2022 is at $478,000. Last year, we were at $467,000, and in 2020, at the same time, we were at $595,000. And on the last page of the report, the breakdown of those 11 incidences, there was 8 at the Board of Ed, 3 at County General, and of those 3, they were at the Sheriff's Department. And that concludes my report.
All right, thank you, Ms. Thompson. All right, for us to have a little discussion, can I get a motion to approve the OSHA report as presented? All right, thank you, Ms. Holly. We've got a motion. Do I have a second? All right, thank you, Mr. Steve. All right, we've got a motion on the floor. Is there any discussion on the OSHA report as presented? All right, hearing none, we'll just do an acclamation vote. All those in favor say aye. Aye. All opposed? All right, motion passes. Thank you. And we'll call on Miss Liz, if you'll come up, please, ma'am, and do our wellness update.
Good afternoon. For our wellness incentives report, as of right now, the goal met for everyone that has met all 3 incentive points were 3,729. Ms. Hickerson, at our last meeting, you had asked me if we could break that up for just County General. And we went into the system. In our system, we have right now 1,263 of County General employees altogether, and out of that, we have 795 that has completed all 3 points year to date. Next, we have for our current and our upcoming activities, we just started our 4th quarter health outreach challenge, which is a healthy bingo. So we're doing that right now, our first week. After that, coming up, we are doing a lunch and learn seminar coming up in November, and we have sent out sign-ups for that. It's like a nice lunch and learn educating seminar for the holidays and eating healthy. We just finished our flu shot drive-thrus for preventative screenings for this quarter, and we had that at 3 different locations. And lastly, just keeping everybody up to date to spread the word about our department outreach podcast. It's the new way that we are promoting or educating and letting everyone know all the opportunities that are available to them each month. So it's very helpful for the employees to look into that every month. And we have a flyer for that if anyone didn't get that. And that concludes my report for today.
All right, thank you, Ms. Liz. Is there any questions or comments for her? All right, we appreciate your report. Thank you, ma'am. Right, we are moving right along. We're going to come up to going to Miss Amber O'Neill, if we'll call her forward to do our MedPoint monthly report, please, ma'am. I guess you'll stick around for our changes, too. Is that going to be right, Ed?
Yes, ma'am.
Okay, all right. So we'll start with your monthly report, please, ma'am.
Good afternoon. All right, so if you'll look at page 3 for your visit summary totals, you'll see that we saw 790 visits in August. Board of Ed had 551 of those visits. County General had 208, and retirees had 31. We saw 637 unique members. We saw 455 visits at New Salem, 187 at Stewart's Creek, and 148 at Walter Hill. In our visit summary by member type, we had 115 children, 561 employees, and 141 spouses on the plan come in. On page 5, for our appointment type summary, we had 110 annual visits, 25 behavioral health visits, 17 dietitian visits, 478 established patient visits, which again is a combination of everything from medication refills to sick visits to, look at the skin rash, any of that kind of stuff. That's all an established patient visit. 13 new patients, 93 nurse visits, 8 telehealth phone visits, and 46 telehealth virtual visits. And those are the ones that include the video component as well as the audio. For the 93 nurse visits, a good majority of those were those biometric screenings that we were doing in the month of September. August had 27 available scheduling days. There were
Amber.
5.
Can I stop you for just a second?
Yeah, I'm looking, I'm saying, why does it say August?
We got September.
I don't know what happened.
My numbers aren't matching yours. You want my copy?
Here, take that one home,
I'm so
because I'm
sorry.
looking at
I
one.
must have grabbed the wrong one out of my bag.
That's
I
all right.
apologize.
That's
All right, let's start over, shall we? I was wondering why you were looking at me like that. You didn't say anything. All right, let's try that again. We had 886 visits in September. Board of Ed had 570, County General had 295, and retirees had 21 visits. We saw 732 unique members, 523 at New Salem, 192 at Stewart's Creek, and 171 at Walter Hill. In our visit summary by member type, we had 106 children, 652 employees, and 128 spouses, for a total of 886. We had 142 annual visits, 29 behavioral health visits, 18 dietitian visits, 392 established patient visits, 21 new patients, 254 nurse visits. That makes a lot more sense now with those biometric screenings. 5 telehealth phone visits, and 25 telehealth virtual visits that included the video component. 127 members had more than one visit in the month of September. 2 members had 4 visits, and 125 members had 2 to 3 visits. A lot of that was the combination of people getting their points for the year. So they would come in and get their biometric screening one day, then come back for their annual visit or a flu shot or something like that, trying to get those in. September had 26 available scheduling days. There were 5 Thursdays and Fridays in the month of September. Wednesday was the busiest day for the month of September. In our virtual appointments, we had 30 virtual appointments in the month of September. Walter Hill still has the highest average virtual appointment utilization. New Salem only saw 1.34% virtually, Stewart's Creek 5.21%, Walter Hill 7.6%. Again, with it being September and us trying to get those monthly points, most of those services, well actually all of the point services cannot be done virtually, so it's not a surprise that we didn't do many virtual appointments in the month of September. In our in-person versus virtual appointments, in September, we saw 95.28% of our visits in person and 4.72% in our visits virtually. In our top 10 referrals by specialty, we had our highest referral source was gastroenterology with 23 referrals. Second was dietitian with 21 referrals, and third was behavioral health with 11 referrals. And please do keep in mind that both the dietitian and behavioral health are in-house referrals within the clinics. New Salem had 98 referrals, Stewart's Creek 24, and Walter Hill 29 for the total of 151 referrals. For our PEPM for September, we had 732 unique members, a total operating cost of $158,709.06, an employee count of 6,297 for a PEPM of $25. In our population health analytics, the encounter for general medical exam and screening for diabetes mellitus were the top diagnoses for the month of September. Again, that's that point screening, but we have continually seen that annual medical exam being the top diagnosis, so that's a really good thing. We like seeing that. That encounter for screening for diabetes is part of that biometric screening, so that's why you see that number so high. It's not because we are concerned that, though we are concerned that people may have diabetes, you will see it higher, especially in September with the biometric screenings going on. In our visit demographic summary, In September, 62.33% of the members seen were female, and the female and male age range of 40 to 49 were the highest population seen. That being said, we still saw a good range of all ages from 10 all the way up to 80 to 89. And in our BMI summary, in September, female and male, the highest percent of BMI is still in the overweight category of 25 to 29.9, hence all the dietitian referrals. But again, we do have a nice spread there as well, and we do have at least almost 20% of our females and almost 18% of our males are in that normal range, so that's pretty good. And that concludes my monthly report.
All right, are there any, okay. All right, are there any questions from Ms. Amber for the monthly report that she's presented?
Could I get her just to explain something really quick?
Absolutely.
We've had a conversation about the virtual versus in-office visits, and the reason why it's trending down, but we expect it to trend back up, and what the influence of COVID has done in order to cause it to trend down. So will you just touch on that for the committee, because I know that's one of the things we're looking at and trying to anticipate what our visits are going to be in the future.
Sure. So part of it is that when COVID hit, we kind of shut down everything, right? Like businesses, everything, everybody was shutting down. So we wanted to give access to healthcare without having to bring people in and exposing others. So we were using virtual care for sick visits over en masse. We've discovered that we don't have to take things that far, that we can bring people in, listen to their lungs, do whatever. So now we give them a choice. And it's better really for those sick visits in a lot of cases if they do come in, because then we can screen them for different types of illnesses such as flu, strep, those kind of things, COVID, and run those tests within the clinic. So we're actually encouraging them now, whereas before we were encouraging them to be virtual, we're encouraging them to come in. Come in, let us give you those tests so we can verify what you have and treat you appropriately. However, we have learned what a benefit virtual care is. And so we're using that now more for things like medication renewals, follow-ups, check-ins, those things that we don't really need to put our eyes physically on you to look at a special spot on your skin or listen to your heart. Now we can do those virtually and just check in, hey, is that medication still working for you? Do I need to up the dose? Do we need to change that? How's that going? Are you taking it at the right intervals? Those kind of things. Or let's check in on your mental health if you're on some sort of behavioral adjusting medication. A lot of those don't really need to be done face-to-face. It's also been warm weather. When it's warm weather, people want to be out. People come in. People walk in our doors. It's nice out. I want to get out of the house. As the weather gets cooler, we're going to see more and more people wanting to do their visits virtually because it's cold out. They don't want to leave the house. They don't want to drive in the rain. They don't want to be in the bad weather. So it just kind of ebbs and flows with whatever the environment is.
Okay, thank you.
Right, so we finished up the monthly report, and Ed, I'll turn this to you and Miss Amber on doing the changes, looking at the changes for MedPoint for our 2023.
I promise I have the right report this time.
Okay.
So with the schools moving to the state, we currently have 3 clinics. And so we were looking at how the county employees that are remaining and how to address the clinics. And so what we've decided to do, back last year, we put the amount of money in our rates for one clinic, and I'll let her speak to it a little bit more in the budget and whatever, but this was already budgeted into our rates for 2023. And then to try to see with one clinic, which would be the New Salem Clinic, to go from 3 down to 1 and still be able to provide this benefit to the local county general employees.
So if you'll look at today's discussion, we're going to talk about the proposed clinic plan. We're going to talk about the utilization of the clinics now, so why we kind of made those decisions that we did, and then the estimated budget for 2023. So going forward for 2023, our covered lives now becomes 2,471 as of 8/1. That was the number of what we thought would be the covered lives that would be eligible to utilize the MedPoint Clinic on the county general plan. We expect the hours and days of operation to be similar to what they were Monday through Friday from 7 in the morning till 6 at night. Part of the reason we made that decision, you'll see on the utilization page, Saturdays are not utilized the way that they should be. So if we're going to use your time, we're going to use your money, let's use it when the patients are coming in, right? Let's use it on the time they're going to use the clinics. And then 50% of the appointment times during that day or during that week will be allotted to the county as their time. So you're only really getting half of the cost, half of that clinic. That staffing would then work out to being a half of a physician, a half of a nurse practitioner as far as cost and utilization goes. One medical assistant, 3/4 of a PSR, which is a front desk person, half of a practice manager, half of a licensed clinical social worker, and 1/4 of a dietitian. Then if you look on the next page for the utilization, you'll see that overall, County General had 3,725 visits from September of 2020 to July of 2022. Of those, 2,132 of them were already at New Salem. So New Salem's already the most used clinic by County General employees. Only 590 of them went to Stewart's Creek, and 1,003 of them went to Walter Hill. I'll remind you again of what I said last month, though. Part of the reason people choose the clinics they do is not always based on location. So please keep that in mind, that it may be they're going there because they like the provider. It may be they're going there because they like the support staff. You know, there's different reasons that people go to those clinics. So with that 50% amount and the single clinic, the new total estimated expenses for the year of 2023, and again, this is an estimate, is $501,759.69. And you can see the breakdown there. $362,556 would be in salary, wages, and benefits. We expect about $28,946 to be allocated to rent, $38,103.24 to supplies, $26,539.93 to purchase services. That's what we name your labs that the patients come in for. So we use a lab service. That's kind of their billing there. For a total expense of $456,145.17, and then there's the management fee added in of the $45,614.52 for the grand total of the $501,759.69. So that is what we hope to be the plan going forward and what we hope to be the cost. And it's a pretty, we were pretty good with our finance team with this cost. I mean, we really looked at the figures. We didn't just guess at these, you know, we really looked over what we have and what we expect. And that concludes my report.
I have a couple of questions, but is this for us to know and decide next month? Or there's nothing to decide, it's kind of set? I've just got a couple of questions. We can start at the back and work forward. If you're looking at your estimated budget, Ms. Amber, wages are set based on the percents, and rent is set.
Correct.
Our supplies and services could be different based on how many we see and what we see them for.
Correct.
But I know y'all have looked at the whole.
We looked at the trending, yes.
The trending, and so this is real close, but just to know that rent is set and wages is set for sure, and there could be some tweaking just based on what we have to send out or.
Based on usage, correct.
Yes, ma'am. All right. So then to go back from that, we get over here to the locations and how we use them for County General. On these visits, are any of those the virtual numbers in any of this, or this is actually a person walking in a body?
It's a mixture of both.
Okay, so this is a mixture of both, virtual
Correct.
and/or, okay. All right, so we're still going to leave the option for virtual open.
Correct.
And then please explain to me the 50% of the appointments allotted to the county. So 50% of what? Are we sharing part of this now clinic with somebody else?
You
Or-
are not currently sharing the clinic with someone else.
Right.
The plan is going forward that you will be, and that is to help share your cost.
Okay, okay, that's, I didn't think we were, and so that's why it was throwing me off. How do we back up to only 50% of the clinic time?
And part of that is simply because we don't anticipate you to have the volumes at this point to fill the full clinic hours.
Okay.
Now, we have the option of expanding that. You know, it's certainly fluid. We can discuss those options. If we see that, hey, you know, you're coming in every day, all day long, and we're filling it up, we would come back to you and have that discussion. It's just based on the trending with the county general employees previously, it's not our anticipation to be the case, at least in the beginning.
Okay, all right, thank you. I just wanted a little more clarification. Yes. Oh, I'm sorry, Ms. Sonia. I apologize.
So I want to follow up on one question that Mary had, and then I have a different question. So on the clinic hours, the 50%, how will you rate that? So like on a Monday, are you saying we're going to have 2 appointments at 8 a.m., 2 appointments and county will get 1, and then the one's left open for someone else? Or how will you dictate we get 50% of the appointments?
So I think, honestly, we are basing this on the idea that you're using 50%, and we're going to do a minimum of a 50%. Like, we're going to say there's no way we're not going to give you at least 50% of our appointments. What we're not going to limit it at is only 50%.
Okay, so
Okay, so like if you have an employee who needs to come in and we've already hit that 50% that day, we're not turning him away.
okay.
Okay? If that's your concern, that's not going to happen. We're just going to say, okay, well, today we did an extra appointment. Oh, well. And we'll count that over time, and we'll see where it goes, and we'll come back with those numbers, and we'll talk about it. But right now, we have no anticipation of ever saying, I'm sorry, you've hit your allotment for that. That's not going to happen. That's not what we're looking at.
Well, the bigger, that's good that you said that. That's not where my mind was going.
Okay.
My mind was going, if under the current process, you know, you can go on the portal and you can see what appointments are available, and that would be all day long, like every hour, 15 minutes, whatever, however it's laid out, and they could select from those. So my thing was, is if we were sharing, I mean, obviously a doctor can't see 2 patients at 8 a.m.
Correct.
So that's where my mind was going. How?
So we've talked about many different ways of how to outline that, and we haven't completely made that plan yet. In my brain, I envision like we have 2 providers that will be in every day. Maybe we split them half and half that day. So, you know, like Dr. Gist sees patients for the first half of the day on Monday for county, and then she sees regular outside patients in the afternoon, and then Carla sees patients in the morning for outside ones, and in the afternoon she sees patients for county general. Or maybe we do, Dr. Gist sees them all day on Monday and Carla sees them all day on Tuesday. But we haven't completely outlined that plan yet. We're still working through the actual logistics of it. The biggest part of it being, though, that if a county general person wants to be seen and we're open, we're going to see them. So.
Okay, so I kind of lied because now I've got a follow-up question to that. So I have another question. So will you still have the appointment selection like we do now, the portal where we can go in and select?
Yes.
So that will still be there? Okay.
Yes.
And then, hopefully, maybe my last question.
Okay.
On the Saturdays, the numbers for Saturdays, were all 3 of the clinics open on Saturday to see patients?
They were not. So what we looked at was not just the overall Saturday utilization, but we also looked specifically at the county general Saturday utilization. The average number of patients who came in on a Saturday for county general was 2.
Okay.
2 patients per week. And so to stay open for the whole day for 2 patients when we would be losing an entire day's worth for that provider on another day did not seem valuable.
That makes sense. Okay, thanks.
Right? Yes, Mr. Michael.
On the salary chart, it says we're paying half a physician, half a nurse practitioner, and so forth and so on. So does that mean if I wanted to go to I could see a physician if I wanted to go. If I didn't want, there would always be a physician there for me to see, not if I didn't want to see the nurse practitioner?
Correct. Yeah, we never limit access to our physician. It's only, the only limitation is the availability on her schedule. So sometimes and I say availability, generally it's a couple of days wait. We're not talking long wait times either. It's just that sometimes she is the most requested. And so if you want to see her for your general PCP care, you may have to wait a few days or to a week or so to get in on her schedule, but we would never limit that choice for you.
Any other questions? All right.
The other thing I wanted to bring up to the committee is this is the final year of our original contract, which is, there's a lot of changes here from the original contract. And again, we're going to look at it. We've done a lot of analysis on this, and we want to keep it and keep analysis. We want to keep it to where the per employee per month amount does not exceed what it should be on the average. And that's why we, in trying to see, can we take a step back on our clinics, revamp, change some hours, try to get better efficiency due to the county employees, utilization of it, and take this year to be able to get a little more visibility, a little more usage out of the county employees, because we've gone through COVID, so you're trying to build it back up. And then, if by sometime, I'd say this mid-year, if these numbers aren't where we think they should be in utilization, then we'll have to come back and readdress it. But that's why we cut it down to share the clinics, because if we just, for the utilization and for the cost per employee per month, it just wasn't feasible.
Top of your head.
Well, there is a contract that it is a 1+1 renewal, but we're going to have to rework the contract due to the fact that we're closing 2 of the clinics.
Right, okay, all right, so we'll have to readjust that, okay? Is there any more discussion? All right, thank you, Miss Amber. All right, we'll turn the meeting over here to Mr. Elam for the discussion on our retirement language update.
Okay, so this is, again, with the clinics, the process with retirement language and dealing with county general employees, retirement plan. This is one of those steps trying to clean things up. The documents that we have all talk about us as together, the county general, and they speak to it all as one. And so, we've just got to clean up and reword some of our plan documents to reflect that it would be county general only. So this is the first piece that we have dealing with retirement. It's basically the same document that you had before. And there's very little changes other than that we did, I'll let Jennifer speak to this, but we did talk about the taking out the stipend plan for several buckets, not the last 2, but the other ones. And the reason why, because I think we only got 20-something people on the Freedom Choice stipend plan. So if you want to speak to that.
The change in the retirement language, the biggest changes, as he said, are the stipend. Instead of that being an option for the for all buckets for the pre-65s, we're now doing that for those in the less than 6 months of service, and then the 6 months of service up to 7 years. Combined between the county and the Board of Education, we only have about 25 participants, and those people will get to continue that benefit, and then when they turn 65, they will move to the plan for that if they choose to. That was the biggest change. The requirements are still the same that we had before. There was no change to what the employees are working towards to get the retirement benefits.
Okay, so that's the biggest change. When you look at the eligibility, it's almost identical to the old one. But it's just the stipend that's been taken out. The other thing is on all post-65s who are eligible to have the option to be enrolled in the Rutherford County-sponsored Medicare Advantage plan, and that also that the current post-65s, you have to enroll this year, and enrollment's coming up in November, but they have to enroll in this plan in the, if they qualify and they're eligible, they have to enroll by 1/1/23. I mean, well, for open enrollment, but it'll go into effect 1/1/23.
Okay, so let me kind of put this out there again. On our post-65 retirees right now, which that group includes BOE. All right, so our post-65 group of retirees, they will have to go on and enroll in the Medicare Advantage. They got to choose something, or if they don't go on and enroll, will they automatically be put into the Medicare Advantage plan?
Yes, so we're going to do their annual enrollment the way they're used to doing it, that if they don't do anything, they still have coverage.
They still have coverage?
Yes,
Okay.
so they only need to let us know if they want to make a change.
Okay, that's what I wanted to make sure, just trying to make sure it's going to be as simple as for our guys, because we're in open enrollment now, and we'd love for you to go on in our open enrollment and do your thing, but if you don't, then you lose nothing. So I wanted to make sure that we wasn't forcing our hands to our post-65s.
The
Okay.
pre or the post will not, if they only let me know if they want to make a change. Otherwise, what they have for 2022 continues in 2023.
Okay, and the stipend change only affects, with this new language, our county general population for pre-65s, because pre-65 BOE has to go to the state. If they're already in our group of retirees, they have to go to the state, pre-65s.
Except those currently enrolled in the stipend, they don't qualify for the state, so they can continue that until they reach 65. And our current county will continue the stipend until they're 65.
Okay, so there is, and I'm sorry for all these questions, so
You
there
were
is a potential that in our retiree group, as of 1/1, we could potentially have some pre-65 BOE because they have the stipend.
Yes.
And, okay, thank you. Yes, ma'am, thank you. Is there any other?
And
Go ahead.
they will continue to have that.
Okay, right, they'll continue to have it, and that's how they get to stay in our group. But once they turn 65, they got to make a choice, and depending on some of it, it goes away. Okay, all right. Any other discussions? Yes, Ms. Sonia?
So I want to make sure that I've understood this too. So where it says the stipend benefit enrollment will end, it just means that the stipend plan is no longer going to be a pre-65 option 1/1/23.
Unless-
But anybody who is currently in it stays in it until post-65.
Well, it's not, there's no new unless you fall into those buckets of less than 6 months or 6 months to 7 years. Otherwise, where we had it for every group, it's no longer an option. It's only for those 2 buckets and then those that are currently in it.
So all new employees won't have pre-65.
New employees that, because the cutoff is if you're 6 months as of 12/31/10, we will get you to 65 with the stipend plan.
Okay.
Because they fall any, like, with I'm hired 2019, so I fall in the less than 6 months bucket. So if I retired before I'm 65, I would get the stipend as an option.
And then it stops at 65.
Correct.
But, okay, so I guess what I'm confused in is it says stipend benefit enrollment will end December 31st, 2022. No new enrollments. So if you were to be pre-65 and was wanting to retire, what would you enroll in?
No, that should probably be reworded to no new enrollment for the other buckets. It's just for those 2. Because
Okay.
that's the only option that they have, and we didn't want to take that away. That's all they had.
You might want to, yeah, we
Yeah.
might want to clean that up because that was a little confusing.
All right, while they're looking at that, is there any other questions or discussions or comments? Yes, Ms. Lois?
Yeah, I just wanted to clarify, because I wasn't quite sure I understood the answer on the post-65s who are currently retired. and we're not having, it's still a passive enrollment for them. And
That's-
then, but even if they don't go in, they will be enrolled in the Medicare Advantage by the insurance department. Okay.
All right. Yes, Ms. Sonia?
Okay, so 2 questions to follow up for that. So the post-65, if I understood correctly, anybody that's currently a post-65 with the Board of Education has an option to stay with us or go to the state? Do they have both options?
Or if they are a current post-65, yes.
Post-65, so they have both options, so they can stay with us. Okay, so that's what I wanted to make sure from that. The other question I had was under the definition section, where it says participant refers to the retiree or their dependent, so enrolled in the medical plan. So is that the potential retiree is enrolled in the medical plan? Does that mean you have to be a currently active member of our medical plan in order to participate in this as a new enrollee? Okay, so 1/1/23. 1/1/23, I decide in June of 2023 I want to retire. I have to be an active participant of our medical plan in order to enjoy those benefits.
Yes.
So if I didn't work,
Years on the plan requirement, yes.
okay, so if I am part of the schools and it's June of 1/1/23 and I met the criteria, but I'm no longer a member of the medical plan, then I don't qualify to get this.
Correct.
Okay.
And on the stipend, it has under consideration stipend benefit enrollment will end 12/31/22 for all eligibility categories greater than 6 months up to 7 years of service.
I think it just confused me because it said no new enrollments, and somebody
Yes,
who meets the bucket can still enroll. It's no additional buckets.
correct. Yeah.
Any other questions or comments? All right. Ed, are we looking to
We're
make
asking-
this?
yes, we're asking-
What are we looking for?
Well, this is our eligibility document, and we're looking to ask for approval to accept this as the eligibility document for the county general employees.
All right, so we're looking for a motion to go ahead and approve this, or we're looking for a motion to take this under advisement and decide next month, or what's the will of the committee, please? All right, Ms. Lois?
I make a motion to approve the document as restated.
All right, I have a motion to approve the document as presented. Do I have a second? All right, Ms. Holly's got a second. All right, now we've got a motion on the floor to approve the Rutherford County Local Government Retirement Plan eligibility and information reinstated as of 1/1/2023. Is there any discussion on the document as presented on this motion? All right, yes, Ms. Sonia?
If you're wanting it to not have to come back, do you want, I don't guess I can make the motion, but would you want to go ahead and whatever language needs to be, and for everybody to vote on that so you wouldn't have to bring it back before to take it somewhere else, that one sentence where no new, would you want to change that wording now so you don't have to, you can then just move it forward? Would you need to do that, or am I the only one confused by it? That may be the question too.
Yes, I'd like because of our time frame and because of the county commission meetings to, our insurance meetings and all are going to be moved earlier, and it's just trying to get it effective as of 1/1/23, to be able to give a little bit of leeway to make sure that, if there's anything that comes up here, that we have a little bit of flexibility to make some corrections, but we're not looking at taking away, as far as the county general, we're not taking away the benefits other than the stipend plan.
I just wanted to make sure you wouldn't need,
Yes.
maybe you or Jennifer to make a recommendation on how to word that one sentence, just so that you could do that and you wouldn't have to bring it back. I was just trying to save you the time if you had to. I don't know.
All right, we have a motion on the floor to approve it as presented. Ms. Lois and Ms. Holly, do you, and I apologize, I'm a little lost because I'm trying to focus on chair and do this. But is there something that we need to put, because y'all have looked at it, Ms. Lois, I know has looked at it, is there anything that we need to adjust or leave the motion open-ended, that if there is a correction that risk management comes up with, to make that adjustment before it hits budget next month?
I think suggestion would be, the chairman, which would be Mayor Carr, to be able to, look at the document and make sure if there's any changes that something comes up between now and the time it gets to, I guess it would go to steering or budget one, that they're able to make those changes to keep this moving forward.
Okay, is it, Ms. Lois and Ms. Holly, is that okay that we put that little stipulation to the motion? All right. Okay, now does everybody understand, the motion is to approve this document as presented, given Mayor Carr, with the assistance of risk management if there needs to be an adjustment before it hits the next committee? All right, now let's do a roll call vote on that, since this is a planned document of such to change. Ms. Thompson?
Dr. Andrea Anthony. Commissioner Carl Boyd. Amber Brown. Shay Crowell. Holly Deering. Brian Gaither. Lois Miller. Brian Runyon. Shantae Sherrill. Steve Spence. Eric Tutobeni.
All right, motion passes. Okay, the next item is any other business. Does any of the committee members have any other business? All right.
Just a couple of
Yes, go
things,
ahead.
real
Yes,
quick.
sir.
Open enrollment for county general employees ends tomorrow at noon. For retirees, open enrollment for county general, pre-65, and all post-65 retirees, Board of Ed and county general, will begin at noon, November the 7th, and ends at noon, November the 18th.
Okay, again, our open enrollment closes tomorrow at noon. You'll shut the system down just like you have us in the past, and we'll call it a day. Yes. go
Sorry to
ahead.
interrupt you. One more thing.
We've been made aware that there's a postcard going out to Rutherford County retirees that can be a little confusing because it says Rutherford County Medicare Advantage Plan while we're trying to send information out to our population about an Advantage Plan. But this postcard isn't from our office, so if you have somebody that asks you about it, it's just their normal annual enrollment period that they're trying to get people to switch switch plans to a different Advantage Plan. So just to be aware, because there will be questions, so kind of, yeah.
It looks very, very real. You just don't see the courthouse on it,
Yeah,
and it has caused some discussion.
Yes, so let them know, it will have the county seal on it, it will have our office information on it if it comes from us.
Okay. All right, thank you. So just another reminder for everybody is anything coming from our office or the county, we'll have the county seal on it. And our retirees' open enrollment is noon, November the 7th to noon on November the 18th. Tomorrow at noon closes the county general open enrollment for the current employees. Is there any other business before the committee? Hearing none, I declare us adjourned. I decline it too.